To get started. My name is Heather Mitchell. I am the coordinator here of the traditional BSN program on the Louisville campus. And I use that word Louisville campus because we actually have a BSN program here on this campus, right here in the classrooms. And then we have an extension program in Owensboro. So we work with students both here on this campus and down in Owensboro. They have their dedicated faculty down there. So I wanted to talk for a few minutes. I'm going to kind of give you a general overview of nursing and our program. Sean, who is one of our advisors, is going to talk about the requirements for what we call lower division. She's going to explain what lower division is, and then I'll talk a little bit about upper division, and then we'll open the floor up to you for any questions that you have. We have two of our faculty members back here, Miss Angie Reynolds and Miss Liz Metz, who teach throughout our upper division program, that they can help answer questions as well. We have our labs open on the third floor, which we'll talk a little bit more about those, but there are opportunities for our students to come in and work and perform skills with mannequins and then also with simulators. We have simulation, and I'll explain a little bit more about that. It gives students the opportunity to work with patients and to have stress type of scenarios, and I'll talk a little bit more about it. I don't want to get too much into detail about that. So welcome, and so you found yourself well here to the School of Nursing. We're a little bit off of Belknap campus, and we have our own health science campus, and that's one of the very interesting things here about our program is that we have this campus dedicated to health sciences, that we have ourselves as nursing, dentistry, we have public health, and we also have the medical school, all located here. What's great for us here in nursing is that really on all sides of us, we have medical centers all around us. We have University Hospital, we have Norton, we have Jewish, we have Kosare. So we're really situated where we're involved in all of these different settings out in our community. So the great thing, and I'm really excited to see so many people here interested in nursing, because right now is a really great time for nursing. It's a really exciting time because we see lots of things and lots of opportunities in nursing. People can come into nursing and have different ideas of what they want to do, and no one ends up in exactly the same role. So I can be nurse, somebody else can be nurse, so we do different things every single day. And that's the great thing about nursing. When I made the decision to become a nurse, on my first day of nursing school, they had this sign up that said, I think it was 1,001. 1,001 things you can do with your nursing degree. And it was this list after list after list after list of all these great things that you could do in nursing. And I thought, oh, yeah, right. Because my mom was a nurse. She worked in the bedside at the hospital. And I thought that's what I was going to do. And once I got in there and realized all the different opportunities, I could do something different every single year and not do the same thing twice. Because there are so many different opportunities as nurses. And you can really find your niche and what really fits for you. So that's the really cool thing about nursing is you're not stuck in one thing, doing the same thing every single day. Even if you worked in the same job for 30 years of your career, no 2 days are exactly alike, right? I see them back there saying, no, I know exactly what you're talking about. You walk in and you never know what you're going to see. And you never know what you're going to do, but it's one of the most rewarding things that I have ever done in my life. Doing that and just having that opportunity to make a difference and having those interactions with the people that I take care of is really powerful for me. So our students, one of the great things about our program, aside from it being situated right here, is that our graduates go on and do a real big variety of different things. When most people think about nurses, what do you think about a nurse and what they do? Those of you all that are sitting here, what do you think? So patient care. Where does patient care occur at? Where do you think about when you think about patient care? Where it occurs? The hospital. Most people think about patient care. So I worked at Kosare. I worked at Norton's. Angie worked at University Hospital. So we worked all these different places. We think about hospitals. But nursing care isn't limited just to the hospital. We do nursing care in a variety of settings, out in the community, working with individuals in the community, making sure that they obtain their optimal level of health. We work in nursing in different types of settings. I worked with a nurse once who did occupational health, and she worked for a business. She worked for UPS and worked with them in doing their health screenings and their hearing screenings annually for all the people that worked on the planes. There are so many different avenues of nursing. It's not just that traditional thought of, I want to work in a hospital. Does that mean you have to work in a hospital? No, but you certainly can work in a hospital. There are so many different things that we can do. Our graduates go on, we see a lot of our graduates go on and work in a hospital setting, but many of them choose to do different areas. We have, not too recently, one of our graduates went on, and she's doing a very intensive research program at Harvard, I believe, is where she's at. And she has dedicated her time to be a research nurse. And she got a very prestigious position at Harvard to do research as a graduate of our program. So our nurses go and work in lots of different settings. So just kind of wanted to give you an overview of what we see. And I'm going to let Sean talk a little bit about what upper division is compared to lower division and that type of stuff. And she has this beautiful picture up here that she just took off of there. And these are our students, and I think this was not your class, was it, Hillary? It's class before you. Or class right after you. So this is our most recent transition ceremony. And what we do when our students transition from lower division into upper division, we have a ceremony to celebrate your transition into upper division and really celebrate with you all the hard work that you've done, because then you get to wear the scrubs and feel like a nurse because you've done all that pre-stuff and now you're in taking your nursing courses. Awesome. So I'll let Sean talk for a little bit and then I'll come back in.
Thank you. Okay, so I'm Sean Sowell. I'm one of the advisors here in the School of Nursing. If you come to U of L and your last name is A through G, I would be your advisor. So we have two other advisors that kind of help with your journey to get to upper division and then ultimately graduate. And so like Dr. Mitchell just said, she explained a little bit about nursing as a profession. So I'm going to quickly talk about the program just kind of in a nutshell. So it'll be really easy to follow. So we're going to get too in-depth today, but when we get done, we're going to open it up to questions. So if you have any questions, feel free to stop me. But if you want to hold off till the end, we can also do that. So I'm just going to kind of look at, you're welcome to look up here as well. This breaks it down a little bit more specifically for you. But if you look at the handout, that has both upper division and lower division. So on the side that has the bird flying, that's upper division's up top and, lower division's up top and upper division's on the bottom. And so and the other advisors, we really work closely with you guys when you come into lower division. It's a really stressful time, and there's a lot of strategy that you need to make sure that you're getting into upper division on time, that your GPA looks okay, that you're getting involved. So with all of that, when you're in a competitive program, stress starts coming a little bit. So who's heard nursing school is very stressful? You ever heard that? the nurses in the room are like, yeah. And so that's what we're here for. We don't sugarcoat anything. It's a serious program. It's packed filled with sciences. But we are your biggest cheerleaders. So between us and the faculty, and I'm sure people at home, we're rooting for you. Okay? So basically, you guys will come in actually, let me see who we have in here. If you are a sophomore in high school, raise your hand. No? Juniors? Yeah, juniors. Seniors? Awesome. Current college students? Non-traditional students? People that are coming back to school, maybe? No? Okay. Kind of? Okay. So welcome. That just gives me an idea of who we're talking to. So for those college students who are already nursing majors, this might be a repeat, a little bit of information you already know, but you guys will come in as freshmen, and we will be with you from day one that you hit campus. So we're at orientation, trying to help you the best we can to get you a schedule you're happy with and one that you'll be successful with in lower division. Okay? And then every semester we meet with you. How's your GPA? How's everything going? And we will do that at least 2 times, if not more. So lower division is very important because you can't get into upper division without being successful in lower division. That's why you have so much support around you at that point. So that's one thing to think about. Another thing is the 2 different campuses that you're on. So lower division is going to be on the Belknap campus. So that's going to be on our main campus. So if we had to give it a number, it's usually about 2 years. However, some of our nursing students take a little bit longer in lower division before they apply to upper division. And sometimes they choose to do that. They want to go a little bit slower so that they make sure their GPA is looking really awesome. So we try to help you with those kind of decisions. With lower division, our program's a little different for those high school students who may be looking at other programs as well. So U of L is a little bit unique compared to other schools in the state that we front load all of our gen eds. So we front load your math and your history and your psychology and stuff that you're like, wait, I want to be a nursing major. Why are we talking about this right now? Would you agree, students in upper division? Yeah. You have to get through those classes. So we front load that. So some of the positives there, which you're here because you're interested in nursing, so we hope you never change your major. You can change your major 1, 2, 3 semesters in and not really be that far behind because you've front loaded gen eds. You have not really started taking major requirements. So those high school students who are kind of like, I'm kind of interested in education, I'm kind of interested in other majors, that's okay. You can stick with nursing and give it a try a few semesters and see if it's a good fit for you. Welcome. So you'll see in lower division, you'll see very few nursing classes. There's going to be 3 nursing courses, NURS courses that you're going to take. One is your Nursing 101. It's a general ed requirement. You need that just to graduate. The other 2 are going to be the last 2 courses you take before you apply to upper division. So that's your patho and pharm. So in lower division, nursing, on here it's called Nursing Pharmacotherapeutics and Lifespan Pathophysiology. Hopefully I said that right. I don't have a nursing background. So you will be in lower division. Your last semester, your sophomore year, you'll be commuting to both campuses. So you actually take patho and pharm down here. At that point, typically the semester you're taking patho and pharm, you will then apply to upper division. So that's where the competitive part of our program really comes in. For those of you already admitted to the nursing program, nice job. Just getting admitted to lower division is not easy to do. But you will go through one more set of admissions criteria here in the School of Nursing to decide if you're competitive enough to be in our program. There's a few reasons why our program is competitive. We only have so many spots in upper division. That's really what it comes down to. However, we also want top-notch students so that they don't take a spot from someone and then not complete our program. So right now we're right about a 98% graduation rate once you get into upper division. So once you work hard in lower division, once you get into upper division, you're solid, you're gold. Okay, so that takes some of the stress off. So the big stressor is getting into upper division. Does anyone have any quick questions before I pass the mic back off to Dr. Mitchell to discuss specifically upper division? Yes, ma'am. No, you're okay. Do you have upper division questions?
I have kind of more specific.
Okay. Do you want to answer or do you want to ask?
Can I just ask after? Yeah.
Yeah, okay, totally. Yeah, I'll be around if you want to ask some individual questions.
How many spots are there in upper division?
Oh, good question.
What's the percentage of students that get in versus no?
Good question. Okay, so every year we admit 180 students. So every fall we admit 90, and every spring we admit 90. And we've raised those numbers quite a bit over the last few years. Every fall, our freshman cohort is anywhere from about 220 to 250. And so it sounds like we're losing quite a few students. But in reality, the national trend is for quite a few of those students to change their major, regardless on what major they started. And so typically in the fall, we have right around 140 apply, 130, 140 apply for upper division each fall. Of those students who don't get in, I would say, I don't have hard data on this, about 75% of them will reapply for spring and get in the spring semester. And so I tell my freshmen, got a couple in here, the odds are actually in your favor to get in. If you're working hard in the classroom, you're working with your advisor, you're very, I can't say likely to get in, but the odds are in your favor. We're accepting more than we're turning down. Okay. Yes?
The criteria for getting in is just generic.
There is, we're in the process of looking at possibly changing our admissions criteria to upper division, but right now we look at your GPA, which is based, I should have stated, solely on your nursing courses that we ask you to take. So if you take a dance class, or you like cooking, or you just love psychology classes, those are not going to help bump your GPA up. It's going to be based solely on this. So we look at your GPA. We then further look at those science scores. Who loves science? Raise your hand. Yeah, awesome. If not, you're going to work hard in those science classes, and that's okay. So we look at GPA that we calculate. We look at cumulative GPA, but the nursing GPA is more important. We look at the science grades. you write a 500-word essay, and then we ask if you've had any experience. At this point, experience doesn't play a vital role. I kind of set it in the criteria. GPA is number 1, science score is number 2, essay number 3, and then experience. But we
minimum GPA though.
Okay, so our minimum GPA to get into upper division is currently a 2.8. That's minimum. So that hasn't, I've been here 4 years and that's not gotten students in. But that's the minimum GPA to apply to upper division. We're going through some processes right now. So if those of you who aren't in college quite yet, there's a chance that we're going to kind of revise those. So if you're thinking U of L is the place you're going to come, and we hope it is, be checking out our website because we may put information on there if we are going to update our admissions regulations and policies and procedures.
And what Sean means by that is we're really talking about looking at admissions, GPA being a part of that, but also looking at the individual as a well-rounded individual and what types of experiences that they have out in the community and what kind of life experiences that they bring in, kind of a variety of things. So what we call holistic admissions. And we're seeing that that's a national trend that a lot of schools of nursing are moving towards. Says it's not really just about grades that makes a good nurse. It's about a lot of different things. So we really want to embrace that because we want all kinds of different types of nursing.
Awesome. So again, I'll be around. I have my cards. If you want to ask more specific questions, I'm happy to answer those. I'm going to have Dr. Mitchell go over upper division and the experience there. Let me get to that really fast.
And I'm only going to talk briefly because I don't want to talk a lot. I want to make sure that you all get your questions answered. And then if you want to go up and visit our skills lab, when I finish here, we have actually now 2 students that have joined us, and we have our 2 faculty members, and we'll ask them to come up, and you all can ask us any questions that you want, and they'll help us go upstairs and see stop the children and see back there. So I wanted to just show you very briefly some of the different experiences that our students have in our program. As Sean explained, during your first couple of years, you take non-nursing courses, those prerequisite base courses that really form that foundation for your nursing practice. And then once you're admitted to upper division, it's 4 semesters, 4 consecutive semesters. We don't do summers. It's fall, spring, fall, spring. So it's 2 falls, 2 spring semesters. In those, the courses that you will take are set. It's a little bit different than what some folks do outside of this program. What you'll see is maybe if you're a biology major that you have to, by the time you graduate, take this many of these biology classes and this many of these chemistry classes and this many of this. Ours are set. In first semester of upper division, there are 4 classes that you take. I wouldn't expect you to memorize these. It's on the handout for you. But I wanted to give you kind of a general overview of what we do in our upper division program. What you'll see in this, starting that first semester, our students take what's called a community health course. Community health is getting from the get-go our students out into the community, working with individuals out in the community, really looking from a global perspective of what healthcare is. This is not just healthcare in the hospital, but this is healthcare and how health affects individuals that are out living in the community, because that's where we see most of our individuals at. As nurses, the patients that we take care of aren't just in the hospital. We take care of them out in the community. We also have students take a health assessment course. This is the one students always love because they get to play with their stethoscope, listen to heart sounds, really do the things that makes them feel like being a nurse, where they can play with all their different nursing equipment. We also do this Therapeutic Nursing Interventions course, which is all the skills. There's a lot more to it, but what people usually appeals to is thinking about the skills when we talk about giving injections and doing dressing changes and things like that. There's a lot more to it, but that's kind of the best way to summarize that course. And then we have a foundations course that really teaches about the foundations of the profession of nursing. Moving on to second semester, we start getting into some more specific classes. This adult health class is more structured as a medical surgical class that you learn about different aspects of medical and surgical care. When our students are in this course, they're in the hospital providing care to adult health patients all across the city. We have students that are at University Hospital, Norton, Brownsboro, Jewish. We sometimes go to VA, St. Mary's. So we're in the hospitals all around the city. We have our psych mental health course, and with this, they're providing psychiatric care in a variety of settings, both inpatient and outpatient. And then research for evidence-based practice. So learning how to be good consumers of research. In our third semester, this is the one everybody wants to hear about because they're really interested many times in childbearing, so mother baby, learning about labor and delivery, or child health pediatrics. So lots of people are really interested in that. So we have experiences where they're working in Coast Children's Hospital, out in the community in schools, working with children, so different aspects. So if you notice there, we're incorporating both community and hospital-based health in all of our semesters. And then we also have global healthcare issues and leadership and management. So we teach about healthcare in a global setting, and then also the principles of leadership and management, how to be a leader, because nurses are leaders. And then our final semester, we do what is kind of this critical care course, learn about the principles of critical care, transitions to practice, which prepares you for interviewing, taking the big Nclex, which is our nursing licensure exam, community leadership practicum, where our students go back into the community and do a big project and are leaders out in the community. And I always think that this one's really interesting when our students are doing this is the coolest experience. They work one-on-one with the nurse for a lot of hours, and they work that nurse's schedule, and they take care of their patients with that nurse one-on-one. And they do about 210 clinical hours, which is clinical several days a week during the course of the semester, and that's really where everything comes together. So we have a big variety of experiences here, and why I wanted to go through that is I wanted you to see really kind of how you have that well-rounded education coming through our program, and when you graduate, you're really prepared to go into a variety of settings. There really is no limitation to what you can do graduating from our program. A couple of other things, and I was going to ask Liz just to talk for just a second. Some other things that I think are important when you're thinking about programs and where do I want to apply, and am I interested in nursing, am I interested in U of L? We offer lots of good opportunities for you to experience nursing in a non-traditional type of nursing setting. A lot of our students work with our faculty and do research. So coming to a large research-intensive university, you have the opportunity to work with faculty members and decide, am I interested in research? Is this something that I want to do? We also have a big travel abroad program. Lots of our students, when they're in upper division, go to different places and provide nursing care outside of the United States. So I see Hillary clapping. Which one did you apply to, Hillary?
I got the Belize one.
So Hillary's going to Belize during spring break, right?
Yes.
Spring break, she's going to Belize. We had a group that went for a couple of weeks over the summer to Tanzania. We have sent students to Croatia, Scotland, Haiti, all over the world. We have a very strong international program, and every year we add something new onto it. And so students go, and in many of those situations, they get credit for maybe their global health course or maybe their leadership and management course, depending on what experience they choose. And the great thing about it is financial aid will help cover the cost of that. So, and they're very reasonable trips. The cost of them, I wish I could go on a vacation like that. It'd be that inexpensive to do. I mean, it still costs money, but it's inexpensive in the whole scheme of it. So our students have lots of different opportunities to explore different aspects of nursing. And then the other thing that I like to share with people, so I mentioned Nclex. Nclex is our big licensure exam. When we graduate from a nursing program, they don't just hand us a license and say, you can go practice nursing. Every school of nursing, once a student graduates from nursing, they have to sit for the board exam. The boards are that final thing, and when you pass it, you get your license. We have a really good pass rate. Our pass rate sits in the mid-95-ish% or so, which is well above the national average for BSN programs. For BSN programs, you see the national average is about 85, 86%. We're usually a good 10% above the national average. And we have done a lot of work during the program to make sure that students are ready for that. So we identify students that maybe need some additional support, and we make sure that we're very intentional and intrusive You like that word?
I do.
That we really do help students make sure that they're prepared, that when they leave here, they're going to pass the Nclex when they graduate. So it's not just about getting you through school, but getting you out there and practicing as a nurse. So that's really about all I'm going to say. I want Liz to talk for a minute just about what it means, what a BSN means, and then we'll open the floor up for questions and if anybody wants to take a tour. Because we still have about 30 minutes or so. So
We're doing good.
All right, so hi, I'm Liz. I do have a last name, but I just go by Liz. It's like Cher. So what I kind of want to bring home to you guys, I know that over the past half hour, you guys have got a lot of information, especially you students. You're probably feeling a little bit overwhelmed right now, right? Thinking about the competitive nature of our program, and just nursing in general, all the options you have outside of nursing if you choose to change your mind. What I want to communicate to you all is, number one, why you need a BSN, and number two, why you need a BSN. So you need a BSN because BSN prepared nurses or baccalaureate prepared nurses are the nurses that have a bigger impact on patient safety and patient health outcomes than any other type of nurse. Research studies have shown that if you're looking at an associate's degree versus a bachelor's degree, that the higher level of education has a bigger impact on your patient surviving their hospital stay. So you have a responsibility if you're going into nursing to get that higher level degree. Why should you get that higher level degree from us? You should get that higher level degree from us because we are passionate about you guys and about patients. And we love watching you guys succeed. I know that we talked about how competitive our program can be. Some of my best students have had to apply twice to get to the upper division. And that is not a big deal, right? They are on track to become excellent nurses. It's just the kind of the competitive nature of nursing in general. But that should absolutely not dissuade you because once you get here, we are passionate. Sean and her OSS team, they are great. And if you do everything that you are supposed to do, if you are really serious about being a nurse and studying and getting, kind of help in your courses, you're going to get in. It might take 2 times, but you're going to get in. And once you get here, we are going to make sure that we do everything we can. We will match your effort inch for inch and make sure that you are successful. Does anybody have any questions about anything that we talked about?
Does it compare other nursing students when applying for jobs? I mean, does
good question.
Are they touted as being, comparing with other graduates from other schools?
We absolutely have a really good reputation in our community. Our graduates usually have jobs if they are going to graduate in May, they normally have jobs on by March. So our graduates don't typically have problems finding employment.
And I teach in the last semester, and all of the agencies surrounding us and far outside are banging our doors down. I get emails on a daily basis from Virginia, Tennessee. We had Pikeville come in not too long ago, which is in eastern Kentucky. They're begging to come and get our graduates because
and some of our faculty.
What was the and faculty? Yeah. And because the hospitals want BSN graduates. They see the value of BSN graduates, and many of them are only looking at hiring BSN graduates, and we're the biggest program. So they routinely, and we have a very good reputation in the community. So we have students, and like I said, we have graduates that are applying and getting jobs at big institutions, Johns Hopkins, Emory, Harvard. They're going and working in big institutions because they graduated from here.
Just as a brag moment, the University of Louisville has only ever had one student go on to Harvard, and it came from the School of Nursing.
This is kind of more specific, but I already have a degree. I have a science degree from U of L, and I currently work at Arlington East, but I want to get into nursing, and would some of my credits
So we actually have 2 different options for someone who already has a prior bachelor's degree. Some students that have a prior bachelor's degree choose to come in and do our traditional BSN program, which is what we talked about. We also have what's called the MEPN program. It is a master's entry program, and so our students that come into the MEPN program, they come in with a bachelor's degree. They take many of the similar classes that our traditional students take, and then they take a few semesters longer, and they graduate with a master's degree in nursing. So we actually have two different opportunities for students that have a bachelor's degree. So we can get you information because the MEPN session is also going on at the same time, and we can give you that information and the advisor's contact information to get you a little bit more. And she'll be here, the advisor, during the reception time.
And if you want to hang out, I'll point out which ones are waived for you.
Okay.
The same goes if you are a high school student working on dual credits, or you're at JCC, your plan is to go to a community college. If you get an associate's degree, an AA, an associate's of arts, or an AS, an associate's of science, we will waive all of our gen eds once you're here. So if you're thinking U of L is the right place for you, but it sounds a little spendy, we have a lot of students that do that. And so there's a lot of different ways to get to your BSN and then further to your RN. And so if you have any questions about that, I'm happy to stay, hang out. And then if you're interested in MEPN or one of the other programs, when we walk out, I'll make sure to connect you with that advisor as well. Any other questions right now, guys?
And you can ask questions about anything.
Yeah.
You have students in here, you have faculty in here, you have advisors in here. So anything, whether it's about nursing, experiences in nursing school, anything like that. Any questions that you have, feel free to ask.
Yeah, I think some some incoming freshmen and their families may worry about their school life balance. And we have some wonderful students in the back who are still standing. I know for a fact they're in upper division, so they made the cut. They're involved in sororities. They're involved in outreach programs on campus. They volunteer for admissions. Some students work. So if you have any questions like that and you don't want to ask in the big group, I'm happy to answer kind of how that goes. But the students would be a great resource for that as well.
How would you go about specializing? Like if you know that you want to specialize in a neonatal area?
So our graduates from our program graduate as generalist nurses, which means that they're able to go and practice in any setting. So many times what will happen, and employers are hiring students to go directly into NICU, which is the neonatal ICU, into pediatrics, into ICUs, in all kinds of varieties of settings. When it comes to that specialty training, we offer experiences through this that will prepare individuals to have that advanced training. We don't give the microscopic details. We look at it kind of as a macro instead of micro. So we provide that basis, and then when you get out and you get that job at NICU, then they'll train you kind of that step further. Every hospital has a very extensive orientation to make sure that you have that additional stuff. All of us that have started as BSNs worked in a variety of different settings. I started as an open heart recovery nurse. Liz, where did you?
I started as a renal TCU nurse.
So we're called dialysis patients. Angie, who's in the back, she is a trauma nurse from University Hospital. What are you going into, Brittany? So she's going into labor and delivery. So we get lots of different people that have lots of different experiences that are prepared to go do those just for graduating from a generalist program. In our capstone experience, by the way, a lot of our students will go and do intensive clinicals in the area that they're interested in. So we do the best to match them up. We'll have students that go into labor and delivery, psych, mental health, critical care, sometimes in ICU, those different types
So
of
you basically, just so I'm understanding, you would get your BSN, and then from there, and you can focus in certain, if you have an interest in a certain area.
I don't think that there's actually a nursing program in a school, at least not that I've ever heard of nationwide, that focuses on a specific area. Everybody comes out as a generalist because the Nclex is set up for generalists. And then after you get out, then you specialize because you have to go into the field that you want to be in. You have to get that job first.
Well, and, I'm sure that the students won't feel this way, but as parents, you know how fast 4 semesters go, right? Like, it's like that, and then they're graduating. we have time in the 4 semesters that we have students in upper division to do a really good job of laying a foundation in critical thinking, safe patient care, those big concepts that they can then take and then apply to any area. It also, if you went through a program and you specialize as a NICU nurse, that would really limit your whole career. And just like Dr. Mitchell said, I never saw my career where I am today, and I bet when I look back in 15 years, I'll be like, wow, I had no idea I'd be doing that, 30 years ago. So having that BSN gives you the options.
I am specialty certified. You have to have so many bedside hours in the place that you want to work before they even let you take the specialty certification. Not only babies are small and they do weird things.
Do you have to apply to the lower division? And if so, what would be required?
Oh, good question. You do apply. So you apply just like any other student. So lower division, you're going to apply to the Office of Admissions. So you're going to go on the website. You're going to pull down apply now. We have an Office of Admissions a staff member here. So if I'm wrong, correct me. So you find the application on the admissions website. You'll fill it out. You'll have a drop-down box or somewhere that you select your major, and you're going to select traditional lower division BSN. I'm not sure of the exact terminology out there, but you apply through the Office of Admissions to our program. Currently, it's a 22 composite on your ACT with a 22 in math. So if you don't have either one of those, things that could happen, your GPA needs to be higher. So your GPA needs to be a 3.0 or higher just to apply. So if you have a 19 composite, you're going to need a higher GPA than the 3.0. So it's kind of a sliding scale. If for some reason you don't meet the qualifications, you may be admitted as conditional, which just means that first semester and or year, you're only allowed to take 14 credits. So we kind of put a hold on how many credits you can take so that we can make sure you're going to be successful. After your first semester, you do really well, conditional can be removed. So it kind of depends on where you're at. So if you know what your ACT score is, you seniors or juniors who've taken it, and you kind of have an idea where your cumulative high skill GPA is, and you shouldn't shout that out right now. I'm not asking you to. I'll be around, and you can ask, here's where I am right now. Should I retake my ACT? Should I not? And we'll kind of talk about the pros and cons to that.
And there is not a cap. It is not competitive in the sense of, are there only 90 spots,
Correct.
120, 140 spots for someone incoming as a freshman to declare nursing as a major. If you meet those minimum requirements, then you're admitted into lower division. You're free to take all of those lower division courses. The competitive, there's only a certain number of spots, is when you're applying from lower division to upper division. For students who don't meet those minimum requirements and are not admitted conditionally, then many of them will take courses that will still apply. They'll still take their prerequisite courses, and then once their GPA is high enough, then they can switch over into lower division nursing and apply. So there are those multiple routes that if you don't get in this way, that you can come in through the side door as well.
Yeah. So high school students, you need to keep working really hard, but if you know, man, I really had a tough sophomore year, or I know my GPA is not quite up to par, let me know and we can talk it out. But for those of you who may be in that boat, who sometimes don't get spoken about, once you get into the university, whether you come in undecided or you come in as nursing, you have one solid semester, and we're no longer looking at your ACT scores. We're no longer looking at your high school GPA. Those are just predictors of how you're going to do in college. So again, that's not to say don't work hard with your ACT, don't keep working hard on your GPA, because that does matter. But I do know some students get scared on the competitiveness that we won't look at your ACT score when it comes to getting you up into the upper division program. We don't. The committee who decides that doesn't see that material, or that criteria. So just to kind of rest some fears.
I'm not an advisor, but I mean, just from my own life experience, I wouldn't take more than 14 credits my first semester of being a college student anyways, just because you've made a huge life change.
Yes.
And you kind of want to give yourself some time to breathe. You don't want to overload yourself with, 18 credit hours.
I feel like I have a ton of Chios, but that could just be chance.
Delta Zetas. I know I've had several Delta Zeta students, Chios. I've seen some.
I think Delta Zeta because of the GPA. Because when students, because I'll say, why do we have, and I can't remember what sorority is, but I'll say, why do we have so many students that are in this sorority? And they say, because that's the sorority that has the highest GPA. And so they'll pick the sorority that has the highest GPA, and they all come in from that sorority. I want to say that it's
I see a lot of
or
DC
Tayo,
stuff
one of
on
Katie.
Katie.
I see a lot of
BSN.
Kate or
What about
Kappa
Sigma
Delta.
Kappa?
Just because we haven't seen it doesn't mean it doesn't exist.
It's just we haven't been
I would say
I
that.
don't ask what sorority or people
It's not on the application criteria. It, more power to you if you can keep up all that social stuff
And we have a lot of students who are in sororities, are in fraternities,
play
and
sports.
play sports.
We have a lot of student athletes.
And are able to balance their lives outside of the school of nursing as well. It's tough, but they work hard and they're able to do it and be very successful. Anything else?
What is the parking for the students?
Or we don't allow parking. We make it fly.
Good question. Right? Yeah, there's students may have better answers. There's parking passes just like you'd buy on any college campus. So there's a garage if you're familiar with where the University of Louisville Hospital is.
That way.
The wrong direction.
My office, I'm usually pointing, I don't know this, but I'm always telling people the wrong way. So this direction, I suppose. So there's a parking garage that you park in, you swipe in and out with your ID, and then there's a bus that brings you a little bit, a shuttle that brings you a little bit closer to our campus. Some students, depending on how often they're going to be down here, there's some free parking right around the garage that they would try to beat out the dental students, the medical students, whoever, which could be kind of stressful. And if they can't find something, then for that day they put money in the meter. So a lot of students will share parking passes too because they are fairly expensive. By the time you get into upper division, you've got lifelong friends already established. Maybe you're living with them. You went through all the sciences together. You had lots of tears and laughter and whatnot. So you're totally able to carpool down. And then often you'll carpool to your clinical sites too. And I see a lot of students who will be employees of some of the surrounding hospitals that will park there and walk over.
Yeah, if you're an employee of a hospital down here, you can use their parking.
Jewish is somewhere. I'm not going to point.
Jewish. University.
Not at all. Thank you guys for your time. We'll be hanging out. What we have going on, we have a reception and the simulation lab, correct?
Brittany, how are you on that? So if anybody wants to go up and see I said I was going to say